Alright, this is mechanical circulatory support in emergency response, and this is going to be a primer for the left ventricular assistant device. This slide set was provided by Integris Advanced Cardiac Care of Oklahoma. What is an LVAD? An LVAD is a left ventricular assistant device. An LVAD takes over the place of a failing left ventricle in order to restore normal blood flow. This is going to be a diseased heart, someone with cardiomyopathy, and this LVAD is going to assist in the left ventricular function by assisting it from an external pump, and that would be this right here, and we'll show you more of this here in just a few. This is a picture of where the LVAD is placed and the pumping unit, and it's placed at the apex in the left ventricular chamber. Blood flow, whenever blood flow is initiated by the left ventricle, it essentially comes down through here because of the big large device hole that's in the bottom of this, and then the pump kind of takes over and assists it, and it'll assist it back into the aorta, which is going to provide more cardiac output, more blood pressure, more afterload pressure, all the things that we need to perfuse everything. They do wear some external devices. These are batteries that are here, and this is the control unit. The control unit is attached to the device through a hole here, about here, somewhere along here in the abdomen area. And whenever the left ventricle contracts, instead of blood flowing out normally, opening up the semilunar valve, it actually shoots out into the pump with whatever force it has due to the failing ventricle. The LVAD then takes over and provides pressure to whatever the left ventricle has ejected. Indications for support on this is going to be ischemic cardiomyopathy, which pretty much means diseased heart, idiopathic disease, unknown cause of cardiomyopathy, viral cardiomyopathy, and all of these cardiomyopathies cause a dilated myocardium, which is essentially a floppy myocardium. It doesn't provide enough pressure. It doesn't provide enough contractile force strength. So these aren't going to give you adequate ejection fraction for ejecting blood out into the aorta. Postpartum cardiomyopathy. This is heart failure in the last month of delivery or within 5 months of delivering the baby. Chemotherapy-induced heart failure. Chemotherapy is essentially a poison. We can get heart failure from it. In certain individuals there is some prophylactic medication. Sometimes this is not found until late. And you pretty much can see any age patient at any time that would require LVAD assistance. And this is a picture of them installing essentially the distal port. The pump, again in the abdomen, would be somewhere down around here. So this is at the bottom of the apex to where the blood would flow out. DT versus BTT. First term we're going to learn here is called destination therapy, and this is a patient that is not a transplant candidate, and they'll pretty much live with the LVAD for the rest of their lives. So for whatever reason that occludes them from getting a heart transplant, they will keep this LVAD, and this will essentially be their heart assistant for the rest of their lives. And then the second type of patient that gets an LVAD is a bridge to transplant. My apologies. Patient is on a transplant list and awaiting a new heart, but until they get that new heart, their quality of life is pretty poor. So what the LVAD does is it assists the heart in providing output. DT patients live longer with the pump and out in the community. So these patients here that are on this list would not have any chance at all. They would die of cardiomyopathy in an ICU if the LVAD works appropriately in them, because of if everything runs like it should and there's no complications on the patient side, then the LVAD itself will add to their life and give them more time, essentially. In Oklahoma, these are the LVAD patients spread out through the state, and this this list and these stars are growing daily. Big stars indicate quite a few in that populace, and the red stars are smaller amounts. The LVAD is essentially a power device, so let's talk about power here for a second. The pump is essentially electric. It has power supply. It has to have power supply at all times. There's two sources of power. There's lithium batteries and then AC power that it can run off of. The batteries in combination, and there's two of them, last for about 12 to 14 hours. If you get into a situation to where you need to change out the batteries, only change one battery at a time. The pump itself will fail if both batteries are being changed. Power module and battery charger. The power module powers the pump when the batteries are not in use, relays information also about the pump function, flow, RPM, pulse index, and how well it's doing on power. Charges up to 4 batteries at a time. This down here, this is the battery charger. This is the actual power module. And it's portable and takes 4 hours to charge a battery. The controller. The controller is pretty much the computer the computer for the pump that houses settings and alarms. So whenever they originally talk to the LVAD and the controller, they do it through this device here. And this is what is attached to the external cord that allows the LVAD to function. The display panel of the system controller has several buttons and indicators on it, and they're very simple, and we'll talk about these here in just a second. First of all, we're going to talk about the red heart alarm. The heart symbol turns red and makes a continuous alarm sound when the LVAD is lost, or it's about to lose pump function. Reasons why the heart symbol turns red: the flow through the device is less than 2.5 liters per minute. A malfunctioning system controller, the pump may still be working. The pump is disconnected, which we should pretty much check the power source. Always check the power first, and then either that or we have had pump failure, which happens not very often at all. The pump on these things are pretty much solid state, and they work very well. The controller, however, has been known to fail on occasions. The emergency bag that we'll talk about here in a little while has a backup controller in it. What to do whenever you see the red heart alarm? You should use a stethoscope to confirm that the pump is working, and normal beating of the heart and pulsations may not be heard. It kind of sounds like a hum. Check the connections. Is there power to the pump? Are the batteries dead? If the LVAD is turned off and there's power to the pump, replace the system controller, and we'll see the following page here and kind of talk through that. System controller essentially unplugs and then we'll replug in. This right here, in a counterclockwise fashion, is twisted off. Whenever you do this, please have the patient lie down, because during this time frame this pump is not going to be working, and very quickly and methodically place this device back into this area here, and this will change out the controller very simply. Other alarms that we may see on levicors, and this is a different type of LVAD, a yellow battery alarm. A yellow battery alarm means that you need to change the battery, and it's located right here. The red change controller alarm, which is located right here where the red circle is, may indicate the pump has stopped. Check the patient, check all your connections, listen with the stethoscope to see if you hear a hum. If the pump is off, then change out the controller. If you do not hear a hum or you're unsure about it, that's why there's a backup controller. Be sure that you have power to the device. Telephone alarm on a levicor. One or more of the levicor parameters is abnormal. Plug in to the base station if possible, and this will run it off of electric power rather than battery power. Pump disconnected alarm, also on the levicor. And the LevaCore is a newer model that has more functions here. Check the connections if you get a pump disconnected. If the connections are okay and the pump is off, change the pump cable extension, which is also provided in the emergency black bag. Batteries. Batteries allow the patient pretty much to be ambulatory, so they don't have to be plugged into an electrical source. Typically, they're in the emergency bag with the controller. 5 green lights identify how much battery you actually have. Each light is 20% of the battery charge. If down to 1 light, it will turn yellow, last one, and an alarm will sound. The battery has less than 20% of its time remaining at this point, or less. One battery should give you up to about 5 hours of power. Changing out the controller. Locate the backup system controller in the black bag, the emergency black bag. Make sure the patient is sitting or lying down, since the pump is momentarily going to stop during the procedure. Disconnect the pump from the current controller by unscrewing the red-to-red cable. That's this right here. Reconnect the pump to the backup controller by matching up the arrows and screwing the red cable to the red receptacle. Very simple. Power failure. And a patient experiencing a power failure with their VAD system will present with signs and symptoms of circulatory and cardiovascular collapse, difficulty breathing, hypoxemia, hypotension. They may go into dysrhythmias, have an altered mental status. What we should do if we see a power failure is focus on restoring power to the LVAD. And this should be done by switching the batteries in the battery pack, connecting it to an AC power source, or switching out the system controller. If we get the LVAD functional again, we will solve all of these symptoms. Common complications that we may see in an LVAD patient. Obviously bleeding. They are going to have them fairly thin. INR levels are going to be about 1.5 to 2.5 times the control. GI bleeding, nose bleeding may be kind of commonplace. Strokes may actually occur. These are common complications. Arrhythmias. The patient may be talking to you and absolutely be in VTAC. We've even seen some here in ventricular fibrillation. We may actually have pump failure occur. When in doubt, treat the patient like you would any other patient. Assessment. You might not get a blood pressure. If the automatic blood pressure doesn't work, try a Doppler and try to obtain a mean arterial pressure. And your mean arterial pressure should be somewhere between 60 and 90. Under 60 or over 90, you might want to get them into to where they can see their LVAD coordinator. EKG rhythm, whatever the EKG rhythm is going to be the native rhythm. So if they were in idioventricular rhythm, whenever they got the LVAD, they'll still be in it whenever you're hooking them up to the monitor. The pump has no effect on the EKG rhythm whatsoever. Most LVAD patients have pacemakers or implantable cardioversion devices or implantable defibrillators. Obtain an O2 sat is normal, and it may be difficult to feel a pulse. Emergency black bag. Must transport with the patient at all times. It has extra batteries in it. It has a backup controller. It has alarm guides in case you don't remember this. It has a stethoscope for listening to the actual humming that's occurring from the LVAD. And it also has a contact number for the mechanical circulatory support coordinator. Take-home lessons out of this. Always transport the emergency black bag. Try to make contact with the VAD coordinator. The LVAD does not interfere with the EKG rhythm. What you see is what you're going to get. Follow all of your ACLS protocols. Remember, it may be difficult to obtain a BP, so think outside the box a little bit on this. Capillary refill, overall good perfusion, mean arterial pressure through a Doppler. All of these should be thought about. Thank you very much.